Okay, welcome everyone. My name is Allison Burns. I am a pharmacist, and today we are going to talk about as needed medications in the congregate care setting. I have no financial interests or relationships to disclose. And of course, we'd like to give a special thanks to our partners at BSAS and the funding provided by the Massachusetts Department of Public Health. Our learning objectives are, I'd like you by the end of this presentation to be able to explain the difference between as needed and scheduled medications, describe what a hybrid as needed medication is and how to handle these in the congregate care setting, list best practices for documenting and observing as needed medications, and identify improper use of as needed medicines and how to approach non-adherence. Okay, medications, including any of your over-the-counter drugs, dietary supplements, and prescription medications can be taken in many different ways. Some are meant to be taken every day. Other medicines should only be used when a specific symptom occurs, such as trouble sleeping. In these cases, the medication instructions will say as needed. The meaning of as needed may be different for different people. So, as congregate care workers, it's important for us to really understand how a provider wants a medication to be used so we can best support the residents. Medications that are taken as needed are known as PRN medicines. PRN is actually a Latin term that stands for pro re nata, which literally means as the thing is needed. Some PRNs are prescribed while others can be purchased off the shelf at a local pharmacy. For example, a resident may be prescribed a painkiller to take as needed for pain, or they may purchase an over the counter pain reliever like ibuprofen that they would take as needed for pain, for example, let's say for a headache or potentially menstrual cramps. PRN medications differ from other medicines because they're only meant to be used when needed for a specific situation or symptoms, such as allergies, constipation, nausea, pain. There are many examples. As needed does not mean that the medicine can be taken again and again until the symptom is gone. Taking too much of an as needed medicine can negatively impact someone's health and lead to harm, because even a small change in the amount of medication in the body can have a big impact on how someone feels and behaves. So knowing the difference between as needed and scheduled medications. So really, what is the big deal between these two? So I have two examples at the top. Number one, take one tablet daily as needed, versus two, take one tablet once daily. Although it might seem like there's no difference between the two sets of directions above, there's a very big difference. And it can have a big impact on the stability and recovery. And here's why. As needed medications are symptom dependent. This means they are taken, again, for a very specific situation or when specific symptoms are present. So, a good way to think about this is think of it as only if needed or only when needed. Taking as needed medications all the time or when they're not needed can cause unnecessary side effects and drug interactions with other medications. An example of this would be a resident can take a medication for a specific situation like Dramamine, which you could take 1 hour prior to travel to prevent getting motion sick. However, if you took Dramamine every day, it causes drowsiness. So when you're not, traveling in a car or an airplane, if you took Dramamine every day, it can actually interfere with your ability to concentrate in work or in your groups. Another example would be a resident can take ibuprofen when experiencing a headache. Ibuprofen can also cause stomach problems, though, such as ulcers and even bleeds. So, taking it every day can be risky. If taken too often, a PRN medication can also not work as well when it's truly needed. An example of this would be if a resident takes diphenhydramine, which is the active ingredient in Benadryl or Banofen for trouble sleeping. The problem with unnecessary nightly use of Benadryl is the body actually develops a rapid tolerance within 1 to 2 weeks. So the more Dramamine is needed to produce the desired effect, meaning drowsiness, or could just stop working altogether. And eventually, a person may no longer know how to sleep without it, even though it's not working as well as it once did. If a medication that a resident is taking as needed is not helping them feel better, they should not take more than prescribed. They should definitely go to their provider or healthcare professional to get evaluated. As needed medications can mask other symptoms and end up making the health condition worse if medical treatment is delayed. Or there could be something completely different going on because nausea, constipation, these are really general symptoms. So you do not want to mask symptoms that have to do with a completely separate health condition. You want to get evaluated if it's not helping. Scheduled medications, on the other hand, they're not necessarily symptom dependent, they're time dependent, meaning they're taken regularly on a set schedule, such as take once daily or 2 times a day. That is known as the dosing schedule. Taking a scheduled medication as needed, whether you're taking too much or too little, is also risky and can interfere with recovery. Taking too much, again, would increase the risk of a side effect or even toxicity. And taking too little can cause a medication to be ineffective because there's just simply not enough in the body to make any clinical difference. So what do these instructions mean? So here's our first audience participation question. Take 1 tablet by mouth at bedtime as needed. Sometimes residents misunderstand directions. Here they may think, I can take as many tablets as I need to get to sleep each night, as long as I take just 1 tablet at a time. But that is actually incorrect. That is not what these instructions mean. The correct answer is actually take just 1 tablet for the night and only if I'm having trouble sleeping. So it doesn't mean take every night if the symptoms of insomnia aren't there. Okay, hybrid medications. What is a hybrid medication? So sometimes a medication is taken regularly, meaning it's scheduled, and as needed for a single health problem. So an example of this would be hydroxyzine, which is brand name Vistaril. Here's the directions. Take 1 tablet by mouth twice a day and take 1 tablet once daily as needed for anxiety. I know this looks confusing, so we're going to break it down. There again is the directions at the top. Take 1 tablet by mouth twice a day and take 1 tablet once daily as needed for anxiety. So the first thing you should ask yourself is, how many tablets or doses are meant to be taken every day? So what's the scheduled dosing? 2. Then number 2, how many extra tablets or doses are meant to be taken only as needed? Okay, so the answer is 1. So what is the maximum amount that can be taken each day? The answer is 3. What is the resident using this medication for? Anxiety. So this means the resident is prescribed to take 1 tablet twice a day, every day, for anxiety. And if the symptoms of anxiety are still not relieved, they may take a 3rd tablet. Do not take more than 3 tablets in a day. Recovery is very challenging. Some days are certainly harder than others. In this situation, that's when that 3rd tablet should be taken. Only on those hard days when the anxiety cannot be controlled by the scheduled doses. If too anxious, a resident can feel overwhelmed or distracted. They're not going to be able to fully participate in the program, which is not good for recovery. So the next question you may ask yourself is, well, then what's the danger in just taking 3 tablets every day? The problem with that is the body will become used to taking 3 tablets, and the medication will not work as well on those hard days when it's really needed. And it's not written for 4 tablets. It's written for 3 tablets. So it's important that you do not take more than the maximum daily dose, which in this case is 3. It's very critical for the resident and the staff to understand why a medication is being taken and when they should take that extra dose as needed. If you think a resident is overusing an as-needed medication, address this therapeutically. This means non-clinical staff, such as recovery specialists, should let a resident's counselor case manager, clinical supervisor, program director, anyone really on the treatment team know what's going on. And if you are a counselor or a clinician, then this means you should probably meet with your resident privately and get more information about what's going on with them. If the symptoms are overwhelming, the resident may need to work on coping skills and relapse prevention planning. If the symptoms start interfering with recovery, the counselor or clinician should reach out to the healthcare provider with the resident to determine the next step. So, meaning have that clinical conversation, and the way to address it therapeutically is offer help in reaching out to that healthcare provider to be evaluated. The resident may need a complete medication reassessment, and that might include increasing the dose or trying a new medication altogether. So, here are some tips for these hybrid medications. Think of regularly scheduled medicines as maintenance. They're used to keep a health condition under control, and as needed doses as extra doses to be used only when the symptoms break through. To remove confusion, I would recommend documenting the maximum daily amount, meaning the maximum number of tablets that can be taken in a single day, on the medication self administration record or tracking sheet. So, for in our example, for the hydroxyzine, I would write the exact instructions on there. And just so people understand how many maximum can be taken in that day, I'd say, maximum daily amount or maximum daily dose is 3. If the symptoms are not relieved by that maximum daily dosage, instruct the resident to contact their provider. Don't just take more pills because something else could be going on. You do not want to delay professional medical treatment, and you do not want to mask symptoms of something else. All right, let's talk about observing, storing, and documenting as needed meds. As needed medications are stored, observed, and documented in the same exact way as all other medications. So that means as needed medications must be stored in a locked, secure cabinet or whatever locked, secure storage system you're using. Some place uses individual lockers. Maybe they use mailboxes. Maybe they use individual lockable bins. Whichever storage unit you use, it still needs to be in there with the other medications. As needed medicines must be kept in their original containers, the prescription bottle or over the counter package with the labeled instructions for use. The staff absolutely still are required to observe residents take those as needed medicines, and staff must document every time an as needed medication is either taken or provided. The following information is required to be documented every time. So you have to have the resident's name, so who is taking this medication, the name or initials of the staff member who is observing that medication being taken or observing that medication being packed to go. For example, if they're going on a weekend pass or they're going on a leave of absence, the date and exact time that medication is packed or provided. So you can't just put it's in the morning or the afternoon. You have to put, for example, right now you would put it 9, let's see, what time is it? 9:19 a.m. You wouldn't be able to just put AM. AM can mean a lot of things. Could mean anything from technically from midnight all the way to noon. So that's a 12-hour gap. You can't just put AM. It's not enough. And then finally, the resident's initials confirming that the medication was either taken or provided. One of the national safety standards that we want you to know is you should not use SIG codes or abbreviations like QD, PRN. Write once a day as needed. This significantly increases the risk of medication errors. Okay, so a resident purchased a medication over the counter and wants to take it as needed. Now what? By law, every medicine purchased over the counter must be labeled with a set of directions on the package. So what you would do is you would see the drug facts directions for any OTCs and look at the supplements, suggested use for any dietary supplements or vitamins. You should go to the directions, warnings, and uses sections. Those are really going to be the most important ones to pay attention to. As you can see on the left side of the screen, that is the template for a drug facts label. Legally in the United States, it's the FDA made it really simple. Every single OTC has to be labeled with those specific sections in that exact same order. So the first thing you do is, one, document the directions off the package verbatim right onto the MAR. Two, I would highly recommend documenting that maximum daily dose or amount that can be taken on the MAR. And then three, document how long the resident should take it before seeing a doctor. You don't necessarily need to write that on the MAR, but you should know, especially the resident themselves should be, advocating for their health and know, how long should I really be taking this product before reaching out to my doctor. Almost every OTC is going to list this in the warnings. Make sure that the resident's also using it for the right thing. Acceptable uses are listed right under the uses section. So here we go. Here is another audience participation. This one's about ibuprofen. So a resident purchases a bottle of ibuprofen, brand name Advil, to take as needed for pain. So how would you document this? The directions, I pulled it right off the back. So it says, do not take more than directed. Use the smallest effective dose. And here we go. Now you see it's broken into two sets of directions for adults and children older than 12, and then anyone under the age of 12, you need to ask a doctor. So in our case, we are treating adults. There are the instructions. So first bullet, take 1 caplet every 4 to 6 hours while symptoms persist. If pain or fever does not respond to 1 caplet, 2 caplets may be used. Do not exceed 6 caplets in 24 hours unless directed by a doctor. So I would locate the directions on the back of that package or container, and I'd copy them verbatim, just like you would for prescription ibuprofen. So what I would put on the MAR is I would put, take 1 caplet every 4 to 6 hours while symptoms persist, max 6 caplets per day. Again, they should only be taking this when they're having symptoms of pain. All right, this is the blown up version of exactly what's on the back of the bottle. I have a couple sections highlighted in yellow. So first and foremost, make sure that resident is using the OTC for one of its recommended uses. There are the uses. Second section. So it temporarily relieves minor aches and pains that may be related to a headache, a toothache, menstrual cramps, muscle aches, backache, minor pain of arthritis, the common cold, or it temporarily reduces fever. The assigned counselor or case manager should check in with this resident. If using beyond 10 days, it says see a medical provider. If the patient refuses, this may not be necessarily the right treatment setting or level of care. I would highly recommend using some strength-based language and approach and a support plan as needed to address that, to figure out what's going on. Long-term or unnecessary use of any as-needed medication can delay proper medical care and lead to some serious side effects that can interrupt their recovery. Encourage the resident to, of course, read the full label and specifically check out that warning section. So here you can see that it says, when using this product, you should take it with food or milk if stomach upset occurs. That is because it can be cause stomach bleeding. It actually even says, this is when you need to stop and talk to a doctor if you experience any of the following signs of stomach bleeding. So if they feel faint, they vomit blood, they have bloody or black stools, and have stomach pain that just is not getting better. You can also need to reach out if you're having any sort of symptoms that may be related to heart problems or stroke. List all of those there. Where did I get that 10 days? Reach out to the doctor if nothing gets better in 10 days. So it does say if the pain gets worse or lasts more than 10 days. So this OTC should not be used more than 10 days. On the 11th day, you really need to be reaching out to a provider to make sure that whatever is going on is actually being properly managed and treated with this OTC, or if something else needs to be prescribed, or even something else such as physical therapy needs to be recommended. All right, here is another one. So, Tums, another over the counter that's used pretty commonly. And here's our three things I'd like you to look at. So, when you look at the back, you're going to see where it says peel here because the bottle is actually so small you can't see the full drug facts. All right, so if you peel it open, because there you can see on the very front of the label, you've got your uses. So make sure, always make sure the resident's taking it for one of the recommended uses. Do they have a sour stomach, heartburn, acid indigestion, or an upset stomach that may be associated with these symptoms? Peel that open. It says, warning, do not use this product. Do not take more than 10 tablets in 24 hours. If pregnant, do not take more than 6 tablets in 24 hours. Do not use the maximum dosage for more than 2 weeks, except under the advice and supervision of a doctor. So here again, if someone is taking the Tums, up to 10 tablets if they are not pregnant, up to 6 if they are pregnant, for 10 days, they really need to be checking. I mean, not 10 days, excuse me, 2 weeks in this situation. They need to be checking in with a healthcare provider to make sure, one, they are not masking symptoms of a bigger health condition going on. So there we go. So number one, what is the directions? It is take 2 to 4 tablets as symptoms occur. 2, maximum 10 tablets per day. Again, that's for your non-pregnant patients. If the patient is pregnant, it's 6, and they do not use for more than 2 weeks. All right, let's get to the troubleshooting part of this. Directions should be clear about how and when to take a medicine. Sometimes the words as needed are left off a prescription label, just so you guys know, because they simply just do not fit. Prescription labels only allow for up to 135 characters. So as needed, PRN sometimes does not fit on there. Or the prescriber may verbally instruct a resident to take something as needed. If the directions are unclear, or if the resident wants to take it differently than what it says on the directions on that label or differently than prescribed, contact the prescriber for more information. You can either contact them, have the resident contact them and get some sort of confirmation of those instructions sent over to the facility. You could always reach out to the pharmacist where the prescription was filled and ask, is this acceptable to take as needed? Or you can ask for them, can you please pull the original prescription, because they can pull the image, and on that image, it's going to have the full instructions, which would be more than 135 characters. Either way, whichever choice you decide to do, definitely reach out to figure out, one, can it be taken differently than what it says on the label? And is it safe to take it differently based on that individual patient? If a resident purchased an as needed medicine over the counter and it's unclear about how much or how long to take it, try calling the provider or talking to the local pharmacist. Note, healthcare providers may feel uncomfortable giving advice on a medicine that they didn't prescribe without evaluating the resident first. So, in general, over the counter medications are intended for temporarily relief over a short period of time. If a resident purchased an OTC and is taking it for more than 1 to 2 weeks, encourage them to be evaluated by a qualified healthcare professional. Something more serious could be going on, and delaying medical care can be risky. Just remember, as needed does not mean harmless. As needed medications can cause unwanted side effects, allergic reactions, and drug interactions at any time. If a resident wants to take a medicine as needed, but does not say that on the label, again, contact the prescriber, contact a qualified healthcare professional to make sure it's okay to do so. In the meantime, requiring a resident to continue to take a medication every day until you hear back from the prescriber can be risky, depending on what that medication is. Every single situation is unique, so you're going to have to use your clinical judgment and involve the right people on the treatment team in the facility to make that call. And of course, I would have the resident involved in these conversations so everybody is on the same page. If the prescriber never calls you back, you can also, again, contact that local pharmacy and ask the pharmacist if this type of medication can be used safely as needed. If you're still unable to get a clear answer, I would recommend documenting what you did either in progress notes or whatever sort of health record system you use there, and then monitor the resident's behavior. Discharging a resident because you cannot tell if a medication can be taken as needed without a serious change in that resident's behavior or program participation is not recommended and may actually cause more harm. We do want to retain our patients in treatment. We do at the same time want to make sure that we are balancing that they are taking their medications as directed and safely. Here is another audience participation question. A resident takes acetaminophen, which is Tylenol, as needed for back pain. Recently, their symptoms got worse, so they saw their PCP and were prescribed a new prescription to relieve pain. The resident claims the doctor said to take the new prescription as needed, but it doesn't say as needed on the bottle. So on the right side, you can see the new prescription. They were actually prescribed acetaminophen 500 milligrams, take 2 tablets 3 times a day. The existing prescription says acetaminophen 500 milligrams, take 1 tablet every 6 hours as needed for pain. So what do you do? The original prescription, they have 2 different prescriptions here. It's actually the same medication. Both of them are Tylenol. Originally, they were taking 1 tablet every 6 hours as needed. The new one comes in and the directions are different. Now they're going to be taking 2 tablets 3 times a day because their symptoms have gotten worse and they have seen their PCP. So when you're looking at this, it's important that you really read the labels. So the existing prescription, if you're taking 1 tablet every 6 hours, that means you're taking 4 tablets. The new prescription, 2 tablets 3 times a day, that's 6 tablets. So if the resident was taking both, that's 10 pills. That means they're taking 5,000 milligrams per day. There's an FDA warning. Taking more than 3,000 milligrams of Tylenol per day can actually cause liver damage, acute liver failure, overdose, and death. And I don't know if many people know this, but Tylenol is actually the #1 cause of acute liver failure in the United States, with 27% of people dying. It's actually responsible for 60,000 ER visits each year. It's actually the second leading cause of liver transplant in the entire world. A lot of people do not know how incredibly dangerous Tylenol can be, but this is an example of when if you have a medication, one medication, and it is the same name, and you're not sure if it's supposed to, the new one's supposed to replace the old one, or if the doses are supposed to be combined, I would highly recommend working with that resident and getting some clarification from the healthcare provider. If you can't get in contact with that healthcare provider, reach out to that pharmacist because they're going to be able to tell you what is the maximum daily dose that can be taken safely. It's very important here. So best practice tip, it's always good to have a complete list of all the medicines a resident is taking, including those as needed medications. For example, if you didn't have a complete list of the previous one, you might not even notice that they have 2 different medications that are taking for the same exact thing. You might not know they're taking 2 different doses, technically, of the Tylenol. Talk to a healthcare professional if the resident is taking 2 medications with the same drug in it, so same drug name. For example, diphenhydramine, which is the main ingredient in Benadryl, is in over 233 medications. And these include medications used for sleep, cold, flu, aches, pain, allergies, etc. So what I would say is on a prescription label, it's pretty straightforward. You're going to look at the name of the drug, and that is going to let you know what the name of the medication is, the name of the drug. When it's a brand name, such as Benadryl, the main ingredient is diphenhydramine. So what you're going to want to do with any of the OTCs, flip the package over, look at those drug facts. It lists the ingredients in it. Ingredients are the active drugs that are inside. If you've got 2 medicines, same drug, you want to make sure you are not taking more than the FDA recommended daily amount. It can be really dangerous. Taking 1 or more medications, for example, with diphenhydramine in it as needed can really actually cause daytime sedation and interfere with a resident's ability to participate. So improper use and non-adherence. How do we handle this? So take as needed does not mean take as much as you want whenever you want. That's not what as needed means. It also does not mean unlimited amount of doses for an unlimited amount of time. Like all medications, as needed medicines need to be used properly, but they can also be used improperly. This would include taking more than prescribed or directed, taking it too often, taking too much, or taking it for a non-medical reason or for a reason that it's not intended for. So some best practices would be if a resident is overusing a PRN, notify the treatment team right away. Make sure you're writing that daily limit or maximum daily amount on the top of the MAR so everyone is clear about what is the total daily dose. Contact a prescriber or pharmacist and ask how far apart doses can be taken. So here's a great example: clonazepam, which brand name Klonopin, 1 milligram. The directions are take 1 tablet by mouth twice daily and take 1 tablet once daily as needed for anxiety. Take at least 4 hours apart, max 3 tablets per day. I'm going to tell you right now, because there's only 135 characters on a prescription label, there's no way they're going to, most likely they're not going to have that second line there, that take at least 4 hours apart, max 3 tablets per day. You're most likely only going to see the instructions that say take 1 tablet twice daily and once daily as needed for anxiety. That's probably what you're going to see. Now, if you see a resident and you think that they are taking these doses again too close together, or they're taking too much, too often, do not hesitate to have that clinical conversation with them, because you are helping to set them up for healthy medication taking behaviors for when they leave treatment. They need to know how to take these medications. So have that conversation with them, and probably the first person that you can reach out to and get an answer right away is going to be calling the pharmacy where that medication was filled and asking, okay, can you please, remember, pharmacists are drug experts. If you do not get an answer from the prescriber's offices are very, very busy. And to put it in perspective, nurses and doctors, they're there to diagnose symptoms. And then based on those symptoms, they prescribe a medication. The whole concept around where dosing comes from and frequency, time of day, that's the pharmacist's job. So we kind of stay in our own lane. So don't hesitate to reach out to either the prescriber or the pharmacist, but you can always reach out to the pharmacist where the medication was filled and say, can you give us a little clarification on, what is the maximum number that should be taken, that can be taken safely, and how far apart should these doses be taken? Either or, pharmacist or prescriber, you can try either person. When you have that extra line there of the take at least 4 hours apart, max 3 tablets per day, it'll make it less confusing, not just for the staff, but also for the resident. They might not know. And when you have symptoms of anxiety, it can be overwhelming, and anything that can help you come down from that really overwhelming feeling is helpful. So, that's just a natural human reaction, but it will help prevent any overuse or improper use by the resident if we have a really clear set of directions. If the symptoms do persist or they're not relieved by the maximum daily dosage, so like the daily, think of a maximum daily dose as a daily limit. Encourage or help that resident reach out to their provider for evaluation. You should not just take more pills. Something else might be going on in their body. Improper use is often a sign of an untreated or uncontrolled health condition. It could even be a symptom of exacerbated substance use disorder. The resident may be misusing an as-needed medicine to help numb sometimes some mental, emotional, or even physical pain. No one should ever jump to conclusions about what they're doing. Definitely notify the supervisor, have these therapeutic conversations, and figure out what's going on. As-needed medicines with stimulating or sedating effects are more likely to be misused. Some examples of these would be any of your benzodiazepines, so alprazolam, Xanax, clonazepam, which is Klonopin, any of your narcotic painkillers, Percocet, Vicodin, sleep aids that are controlled substances such as zolpidem, which is brand name Ambien, your muscle relaxers, Sudafed, so pseudoephedrine products, loperamide, brand name Imodium, and dextromethorphan, which is the active ingredient in Robitussin and many other cold and flu medicines, not just cough syrups. So this is just a very short list and some examples. Acceptable use, taking less. So for an as needed medication only as needed, taking less than prescribed is acceptable. This actually means that their symptoms are under control. As needed medications can generally be stopped safely since they are only used for symptomatic relief. If you have any questions, call the prescriber. Since as needed medications are, since PRNs are taken as needed, there's no missed doses. So there's no such thing as a resident missed the dose or refused a dose. If you have questions about this, definitely reach out to the provider or a local pharmacist for questions. But again, when you're taking less, if it says take 1 tablet as needed twice daily and they don't take any that day, that's great. That means their symptoms are under control. It doesn't mean you need to take 2 tablets every day. There's some other questions that you should ask. So if you do notice that they just stop taking it altogether and you see a behavior change or you think there's something else going on, you can ask some questions like, did they have access to their medications? Did they miss their the designated medication times? Did they, are the symptoms getting better? Are they getting worse? What's going on? If you have questions about taking less. Here's a good example, clonidine. Okay. So clonidine, here we got the little bottle on the right, 0.3 milligrams. Take 1 tablet 2 to 3 times a day as needed for anxiety. This means the resident can take clonidine up to 3 times a day. Do not take this if you're not experiencing any anxiety. So the daily limit is 3. It also does not mean take 3 tablets at once. The resident should not be considered non-adherent if they are not taking an as needed medication every day. Again, if you notice that behavior change or something else going on, contact the treatment team or provider right away. Non-adherence, some specific medications. So some medicines should almost never be taken as needed. And these include medications that are taken for infections or for chronic long-term health conditions. So here's some examples. Antibiotics. You don't take antibiotics, as needed. You need to finish that course of treatment. The only reason you would stop it early is if a healthcare professional told you the antibiotic is no longer needed. You do not want resistance from antibiotics. Antivirals, so medications that are used for HIV, AIDS, hepatitis C, we don't take those as needed. We need to finish those. Some psychiatric medications used to treat major depression, bipolar disorder, and schizophrenia absolutely need to be taken every day to control those symptoms of those long-term health conditions. Medication assisted treatment. We don't take just a Suboxone on Monday and then decide taking one on Friday. That's not how it works. It's taken daily. And then especially the progesterone only birth control pills. Those actually have such a tight window for dosing. If you take it 4 hours later than you did the day before, you actually risk pregnancy. It's a very tight dosing window there. So a good way to remember these medications is I always think of it as which ones should I almost never take as needed? The A's plus birth control. So your antibiotics, antivirals, antipsychotics, antidepressant, anti-craving medications, plus my progesterone only pills. These are sometimes called POPs, just so you know, POPs. What to do if you suspect improper use or non-adherence. When medications are taken improperly or not as prescribed, there's a risk the resident could destabilize or even relapse. If you suspect improper use or non-adherence, notify your supervisor and the treatment team right away so they can address it therapeutically. Again, use that strength-based approach, a support plan, and coordinate with their prescriber or healthcare provider to determine if medical supervision is needed. Here are our takeaway points. So we need to support our residents. If the instructions for a medication include as needed, make sure the resident understands that. They should understand the reason they're taking the medication and when it is appropriate to use it. They should understand how much medication to take each time, how often to take that medication, the maximum amount that can be taken each day, and the situations when that you can take that extra as needed dose for the hybrid medications. And also, of course, when, and I would even say how to contact that prescriber for advice. Okay, conclusions. PRN or as needed medications are a very important part of the therapies that people take to manage difficult and different health conditions. Be sure the resident understands situations they can take an as needed dose and also the maximum amount that can be taken each day. Make sure your residents are taking their medication safely and always ask a healthcare professional if you have a question. And that is all we have for as needed medications. Does anyone, I'm going to open it up. Let me see if I actually can't see if any had raised their hand yet. I see someone raise their hand. It's hard for me to see.